The only thing that he has done in the past is a little bit of cheek filler. I think I'm going to do a tiny little bit more tonight just to help with this kind of like little weight right here. So if you see here, if we add a tiny little bit right there, even if it's just a little bit, it helps a lot with this. So that is going to make the jawline look a little bit better. So we'll do that. We'll do a tiny little bit of cheek. And then he has really prominent masseters. So I think that is the reason, or one of the reasons why he looks a little bit bulky right here on the lower face. So he's not the best candidate for jawline, but we're gonna make it work. He's a challenging patient because he has this bulkiness right here, right? And on top of the masseter being very prominent, he has a little bit of skin laxity right here. So I don't think we're gonna make the jawline shine as good as the patients that we see on the before and afters, but we definitely can create some definition right there. I was checking for his submental fullness, and he doesn't have a lot of fat right there, or subcutaneous fat. So I'm thinking he has a little bit of pre-platysmal fat. So remember that we have the muscle and we have fat under and over, right? The subcutaneous fat, the one that is in between the platysmal muscle and the skin, that's the one that we can treat with Kybella or liposuction in this matter. The one that is floor of the mouth and the platysmal muscle, that one we cannot reach with Kybella or with lipo. So to isolate that subcutaneous fat, you can ask the patient to put the tongue in the roof of their mouth, and that isolates that subcutaneous fat, so that if you pinch and they still have, if you pinch an inch, you can treat, right? That's a little rule. So if you pinch and they still have a little bit of fat right there, you can do Kybella. If not, it's more like that fat that we cannot reach with Kybella or lipo. So, and that's his case. So he doesn't have a lot of that fat that we can reach, or the subcutaneous fat. That's that with Kybella, right? He's not the best candidate for Kybella. I think you have a tiny little bit of skin laxity, so maybe some kind of like a tightening kind of treatment, maybe Morpheus, or even some smooth PDO threads you can do, kind of like to stimulate the collagen right there and make that skin kind of like stronger. But the plan for today, we're going to use Voluma. We're going to do a little bit of Voluma on his cheeks. I'm thinking maybe just half and half, but it might be the 1-in-1. Again, we did just 1-in-1 that time, right? When we treated you?
I think so.
Right? Okay. So that's not a lot. And it's been a couple of months. But I'm planning for half and half. Let's see if we need the 1-in-1. And then we're going to do a little bit of Bullocks on the Jawline, which is the indicated product by the FDA. It's Juvederm Bullocks on the jawline, and then we're going to do a tiny little bit of Voluma on his chin and the pre-jaw area. Bullocks is indicated for jawline and chin, so we could treat chin with Bullocks. I think I like better Voluma on the chin. We still do kind of like, the chin is moving with our face, and I feel like Voluma is a little bit softer, so I just like how it looks better. I do a lot of Voluma, a lot of Restylane Define on the chin because of that reason, because it moves a little bit more. Bullocks is very robust. The G prime is super, super high. So I feel like in my head, I don't want to put something that is too thick on the chin. I will definitely feel comfortable with doing it in the jawline. And one thing that I tell my patients all the time is, like, when we do Voluma, you're going to feel the product for the first 2 weeks. Okay. It's going to feel like a little bit lumpy, bumpy. That's very, very normal. It's just that little swelling that the body creates surrounding the product. With Bullocks, you're going to feel it for 4 weeks. Okay. It's going to feel bumpy. It's not going to look bumpy, any of the two, but it's definitely going to feel bumpy whenever you touch or you wash your face or you put your products. Okay. So that's very normal. Don't worry about it. Don't mold it. Don't massage it. I'm going to do that for you before we leave. Sounds good?
Thank you.
Yeah. Comfortable right there?
Yeah.
Okay, very good. Pencil, okay?
No
Just
problem.
gonna mark. I'll let you know when I'm in the book. So we're gonna do the hinder lines, ala of the nose, mid tragus, then lateral canthus, oral commissure. And when I'm doing cheeks, I like to mark everything that I see. Like, he's showing a little bit of that soothe and a little bit of that depression, that nasal jugal groove. So I'm going to mark that just to be aware of everything where it is. And what I always explain to my patients, that the nasal jugal groove, we're not going to be able to erase it completely, but it's definitely going to get softer after we do the cheeks. And you know, the males naturally are supposed to hold their volume more on the apple of the cheek more than lateral. So we're going to do just a tiny little bit on the apple. Don't do a lot of lateral projection because that's kind of like feminizing the face. So concentrate more on the apple of the cheek, or the anteromedial for males. Remember that, open your eyes for me. So mid pupillary line, around 2 centimeters under the mid pupil. That's where your infraorbital foramen is. Okay, so that's something that you can mark too if you want to be aware of that. We're not going to be close to it. Normally, if I do the anteromedial cheek, I normally do it with cannula just to stay away from the foramen, and I do it a little bit more superficial. You can use Wrestling Contour is great for that area. I really like it because it gives you volume and projection, but it's soft at the same time. I have used Voluma too. Lift, I think it's a little bit too robust for that area. And if you're going to do Voluma, just try to stay a little bit deeper because it could be a little bit too much too. So I feel Contour. No, we're not going to do this area. No, I'm going to do needle right here, just a couple of pokes. He doesn't need a lot. But I think it will look better if we did just a tiny little bit. I'm planning for just half. Okay, so let's mark his jawline. So we're going to mark the gonial angle. And what I was explaining to the patient before we started is because he has this fullness right here and he has such a prominent masseter, I don't want to add a lot of product because we don't want to make his face bigger, right? We just want to create definition. So I'm not planning on adding anything on the ascending ramus. I'm more planning on adding a little bit on the bottom of the jawline, right? And a tiny little bit on the chin, just to complement the jawline. And that's why I'm telling you guys, it's not going to be like that before and afters that we see in the pictures, but it's definitely going to be something. And then always mark your notch, right, where your facial artery is. Super important. And then what I do, I just mark kind of like I place my finger under the jawline and I just mark exactly where their bone is or the jawline is. And that's what we are trying to recreate with the product. And the notch. Right, the notch is right here, the angle is right here, so just always mark your angle. And I want to do, I don't know if you guys can see, but he has a little bit of this indentation right here in the pre-jaw area. So I'm planning on doing a little bit of Voluma right there. I think that's going to be very nice and it's going to complement the bullocks. So I'm going to stay kind of like far back with the bullocks. And then I'm going to do a tiny little bit of Voluma right here in the pre-jaw area. And when I'm marking the pre-jaw area, I always do this. And I just kind of like let the tissue tell me where that jaw is because he doesn't have a prominent jaw, right? So I just do this and you can see the fold. It creates the fold naturally right there. So I'm going to mark there, right? So we don't add too much product right here, just on the border, okay? So same thing on the other side. And if he didn't have this fullness right here, I would go with bullocks and do even like a full line of product right here just to make it a little bit more prominent. But like I said, I don't want to make his face bigger. So we're going to do just a tiny little, not a hockey stick, but just a little bit on the angle, on the gonial angle, and then more on the border of the jawline. And remember, the notch is always, if you, for any reason, you cannot palpate it with your finger, just have the patient clench for me. And it's right in front of the masseter. The border of his masseter is right here. Look what the notch is. Exactly like it correlates always with the border of your masseter right there. So that's another way of finding that little notch or the area where that artery is. And again, with the cannula, right? Most of the jawline I do with a cannula. So with a cannula, you're superficial enough that you're not supposed to be even close to that artery, but always be very careful. And remember the chins for the males, right, are more like square. So we have the option to do 2 injection points instead of just 1. Like with a female, you always do kind of like just medially, right? To kind of like elongate and make that chin a little bit more pointy or more feminine. With males, we normally do 2. We can even create that cleft kind of like chin if we wanted to. Not everybody wants to, so just ask your patients first. But definitely the chin of the male, it's supposed to correlate more with the oral commissures all the way down, which, I mean, his chin is good. So we're not going to add too much. But once you mark the chin, and then once you do kind of like this motion, you can see exactly where the pre-jaw area is. And you can see how it's a little bit, he needs just a tiny little bit. So I think that's going to be a nice thing to add. I think his profile is good. Like if you see his profile, he doesn't need a lot of chin projection, so we're going to do just a tiny little bit of projection. Very good. Ready? Okay. So Voluma, it's indicated for cheeks and chin for 18 to 24 months. So it's a great product. It is, if you compare it to Restylane Lift, I feel it's a tiny little bit softer than Restylane Lift, but not as soft as Restylane Contour. So it's kind of like, if you put them in order of consistency, if you want to do kind of like really sharp definition on the lateral portion of the cheek, I love Lift for that. Contour is great for the medial cheek, right? Because it's softer, but it still gives volume. And Voluma, I feel like it's a nice kind of like in between those 2 products with a longer duration, 18 to 24 months, because you can work medially and laterally. It gives volume, but it's soft at the same time. So it's a great product. So if you haven't tried it, you have to. I love it. Beautiful. Periosteum. Aspirating. Perfect. And I normally do tiny little boluses of 0.1. How was it?
Perfect.
Good. Perfect. Periosteum. Aspirating. And you see how I'm pulling the skin? I feel whenever we do that, you just create that little lift. So I always do that. That's something that I learned early on, and I just like how it looks. I feel that it gives you better correction when you do that. So pull the skin up and then inject. So you're kind of like almost like holding the skin there. If you need a break at any point, just let me know.
Oh, it's less painful than the shaving.
Very good. I'm going to do one right here, and we're going to jump to the other side. Perfect. And I did 0.15 on each one, so we have done 0.3 total. Crunch, crunch, okay, crunch. Good. Beautiful. And when you aspirate, remember that you're supposed to aspirate nice and slow, and you inject as well, nice and slow. That way, if something's going on, you're going to be able to see the changes on the skin, right? And the patient is going to be able to tell you if they're feeling anything out of the normal. So now I'm going to change my needle, and I'm going to go to the other side. So I don't know if you guys can see it, but you see how much it's kind of like lifted on this side, and you don't see as much the line and the soothe. It just looks smoother and lifted. And we did just like a 0.5, and I did very medially, right? Because it's a male, right? So we want to enhance the medial cheek. So we're going to do the same on the other side. Okay. And that at the same time is lifting a little bit of the jawline. So it's helping us with the jawline too. So whenever a patient comes to you and they're asking for jawline, I would say 90% of the time, except if it's a 20-year-old patient, right, that they just want to enhance their jawline. But 90% of the time, they're going to end up needing mid face first. So cheeks first and then jawline, because the correction of the mid face is indirectly going to help you with the jawline. Okay. Perfect. Good. Beautiful. Like that. Okay. One more, okay? Perfect. Perfect. Periosteum, you're touching bone. You aspirate nice and slow. And you inject nice and slow. Perfect. Okay. Like that. Okay. Let's do that little one right here. Kind of like the same on the other side. Little hook. Crunch, crunch, okay? Crunch. Perfect. So I did a 0.15 on each one, the first two, so 0.3, and then another 1 at the end. So I still have like a tiny amount. So now let's enhance a little bit of the jawline. I'm going to start on that side with the bullocks.
Okay.
I'm going to do a couple of injections with the needle, okay? Majority of the treatment is going to be done with a cannula. So I feel the cannula is a little bit easier for you as a patient. It's safer for sure for you and me. So that's why we choose cannula in those areas. But we're going to do a couple of injections with the needle first.
Sure.
Those ones are, you could feel a little bit. And bullocks, when we first got it, because it's a lot more robust than Voluma, right? The first thing that I thought was, oh my God, how hard it's going to be to push, right, in the syringe. But it's really not. It's nice and soft. It's super easy to push. It's a lot more cohesive, and that's why it gives so much volume, which is really nice. You can create a lot more volume and definition than with Voluma or Lift. Very good. Same thing, periosteum, right? Aspirating. I always keep my finger here. And because his masseter is so prominent, I mean, you can decide, like, if it's a female, I will do maybe like a 0.1. If it's a male, you can easily do a 0.2 or even 0.25. I'm going to do a 0.2 on him just because his masseter is so prominent. And I don't think that is going to be like huge for him. A little bit more. So I'm right at that angle, and I'm creating that little, kind of like that little triangle again of the gonial angle. And I'm going to put maybe another 0.2. And for males, it's very common that they need more product. The rule is not to use more than 4 syringes at a time, okay, with patients. Males definitely can use the 2 and 2. That's not a lot of product for a male. So I'm thinking we're going to end up needing maybe 1.5 on each side. So 3 syringes total of bullocks. And then maybe 1 of Voluma right here. In between that tiny little bit of chin that I want to do in the pre-build area. Crunch, crunch. Right there, I'm right on the border. right on the border of the jaw. Okay. I like it. I'm starting to see it. Okay, very good. So now we're going to do a little bit of cannula, okay? We're going to move to more superficial. I did a 0.5, okay, deep, which is not uncommon. So let's work superficially, and I'm going to place a little bit of superficial product right there, just on that angle, so we can create a little bit more definition there. So I'm going to move to the cannula. The cannula we're going to use, it's a 25 gauge, 1.5. Because of the properties of the product, you may think that it's hard to push, but it's really not. It's nice and soft, just like if you were doing lift or voluma. Same extrusion force. So I'm going to do that little entry point first, okay, for the cannula. So it comes with a 23 gauge needle and the 25 gauge cannula. Since I want to create that definition, let's go this way. Okay, remember that your artery is right here. Your cannula is like 1.5. So if we go in here, we avoid the artery and we can reach all over here. So little book. And you don't have to go all the way in with your needle. Remember, the deeper you go, the easier it is to bruise him. Remember that you're just creating a little entry point on the skin for that cannula to glide in. And I always pinch a little bit so I can see the tiniest drop of blood where the cannula went in, so I know where to go. If not, I feel like whenever you start using cannula, the hardest thing is to find a little hole. But after that, it's nice and easy. Okay. And I'm holding it as a pencil, if you see. I think it's easier just to kind of like glide it in for the first time. Okay. Little movement, okay? And doing those tiny little back and forth movements, I think it's the best thing to kind of like glide the cannula in the right plane. You want to be in dermis, right? You don't want to be super deep or super superficial. You see how you can see the depth of the cannula, right? But you don't see the color. Remember, this product is nice and thick, so you really don't want to be too superficial. But you don't want to be too deep either, because then you lose it, right? So just dermis, okay? You want to see the shape of the cannula, but not the color, kind of like that depth. Okay, and we're right at the angle right here. You can still see the mark and where I was injecting. So we're going to create a little bit of definition right there. And I'm going to do tiny little lines. I'm going to go back. Remember, your parotid gland is nice and superficial right there. So if you're creating that other line that we normally do, we're not going to do it right now, but remember that you're kind of like close to it. So be careful with your depth. And obviously, if your patient is complaining of pain, it's probably because you're in it. With males, because of the hair follicles, sometimes you will have a little bit of a harder time to kind of like glide the cannula under the skin. So just be aware of that. Nice, nice, nice. You can see that. Perfect. And you can definitely feel the product, okay? That's very, very normal. And let the patient know that they're going to feel it, right? For the next couple of weeks. Actually, like the first 4 weeks, you're going to be able to feel the product. It's going to feel like a little trail or a little worm, okay, of product. That's very, very normal. Mouth for me? Okay, good. Okay. You don't want to see the product when they open their mouth wide. So that, I feel, it's dependent on the amount of product that you can do. Don't do too much where you can see that product. I don't think it doesn't look nice. It just doesn't look nice. I'd rather have not as a sharp result, but not being able to see that product if the patient is opening their mouth wide. In general, right, if a patient complains of pain, you stop what you're doing, because that can be vascular occlusion but I've never had the experience personally, but they say that if you go into the parotid, it's like very painful for the patient. So the patient is going to jump. So you definitely know if that happened. So that's something that I've heard. Again, it has never happened to me, but it's supposed to be painful if you go into the parotid. So let's start adding a little bit of that voluma right here. We could add a little bit of bullocks. just right here, not on the chin, but on the jawline. Let's add a little bit of bullocks first, and then we'll finish the pre-jaw area with Voluma. Okay, so we're gonna change to the second bullocks. And what I'm gonna do, I'm just gonna refresh that same little entry point of the cannula. I'm just gonna refresh it on the other side. So if the patient bruises, he's gonna bruise in the same little area instead of creating a whole new entry point. So same little entry point, little poke, just going towards the other side. And that should be enough so we can reach kind of like the border of the jawline over here all the way to the chin. Very good. And just like in the females, right? You want to be kind of like right on the border of the jawline. So you can see the cannula, the depth, okay? You see the shape of it, but not the color. And we're going to add just a tiny little bit of bullocks right there. Just on the jawline. Good. And remember, you have your jowl, right? He doesn't have like a lot of the jowl, but you have it marked right there. So you don't want to add too much product right there. So we're technically adding product just in this little area right here. A little bit of movement. And after you do that first or second pass, the numbing in the product starts kicking in. So they're not going to feel much. Yeah, just creating a little bit of that volume and that definition. Yeah. Mm-hmm. So again, I didn't add too much right here, right? Where we naturally create that jaw. I added a little bit more kind of like in the pre-jaw area that we have marked before, and then a little bit behind it. I'm going to use the half, okay, on the pre-jaw area or the jawline over here, just on the border. I have used a 0.3. So I'm going to use that 0.2, and then we're going to save that half syringe for the other side. So we're going to use 1.5 on each side, which is what I have planned for. And remember, we already treated both cheeks. So you're already looking better on this side. But if you, let's turn this way. See the little definition right there, right? And we're still going to do a tiny little bit of chin, which is going to help with that compared to this side, right? Where he doesn't have a lot of definition. And it's subtle at the same time, right? Which we want. We don't want to do like crazy looking stuff. And we can always add more. That's what I always tell my patients. We can always add more. So don't go crazy. I think if you do it gradually and subtle, it's easier for everybody else around you, right? Your coworkers, your family members to kind of like not being able to put the finger in what we're doing. You're just going to look better like gradually. Beautiful. Doing good. Aspirating. Good. So we're going to do the same as we did on the other side. Okay, we're planning for a 0.5 or half of syringe right here. So I'm going to do a 0.2. Nice and slow. And always kind of like you're assessing how much you're pushing, but you're assessing the skin and the tissue, right? And the patient, if they're not complaining of pain or anything like that. Aspirating. And when you aspirate, I like to, when I teach, right, I always like to tell the trainees that when you aspirate, you want to see a full 0.1 bubble of air on your syringe. That's a true aspiration. I see some injectors kind of like just flickering the plunger a tiny little bit. That's not a true aspiration. Nice. Like that. Okay. Done 0.3. So let's do one more. Beautiful. So I did a 0.5, a little bit less than 0.5. Let's change to the cannula, okay? And let's create that definition superficial, especially for patients like Dr. Sewell, right? Don't waste too much product deep. I did wanted to create a little bit of that definition right there, but don't waste a lot of product deep because you can do like the full syringe in there and you're probably not going to see it as much because of his prominent masseter. So I'm just creating a little bit of definition right there. And then the rest, we're going to do it with a cannula more superficially. I think that is what he's going to be able to see a little bit more. And the artery is right here, right? We marked it. So we're going to be a little bit like farther from that, obviously, but not too far so we don't reach with the cannula. So it's going to be around here. And that way we can reach kind of like the gonial angle and that gonial notch. And then the pre-jaw area as well with the same entry point. So that's something that I like to do. Okay, so we're going this way first. And you could, since we're here, I'm going to do it on the opposite side too, so we don't have to poke him twice. That way I know that we can go both ways, if that makes sense. So I went in and I created the entry point going this way, and then I came back and did the entry point going this way. So now I know that the cannula can go both ways. So I'm going to hold it like a pencil, right? Okay, a little bit of movement, okay? And when you're working with cannulas, remember, just be very careful not to touch the rest of the cannula whenever you're going in, not to kind of like be gliding the cannula over the skin. Remember that the cannula is sterile, right? We need to keep it that way. So depth, okay, of the cannula, you can see the depth right there. And we're going to start adding a little bit of product. And really, I'm more watching the skin than the actual syringe, but normally it will be kind of like maybe a 0.1 little line. Okay, every time that you do a line, it's going to be like a 0.1. I do want to add a little bolus right here to create a little bit of that definition right there. And always checking for the depth of your cannula. Like that. So we did a 0.5 deep with a needle on the gonial angle. And then we did the other 0.5 kind of like superficial, kind of like on the border of the jawline over the notch, right? Because remember that because of that notch, right, we kind of like lose a little bit of the definition right there on the jawline, males and females, same. So that area is always so important to kind of like make it stronger again. So we still have the other 0.5, right, of the, so we finished with the bullocks. Now we have the other 0.5 that we use half over here. We're going to finish the other half over here. We're still with bullocks. Okay. So now let's go this way. A little bit of movement. Very good. Awesome. We can get a little bit more superficial. You're doing great. Okay. See the depth, okay, of the cannula? A little bit deeper right here, but we're not going to add a lot of product. This is what I want to target, okay, that pre-jaw area right there. We're just going to define kind of like the border of the jawline or the pre-jaw area right there. And then right now I'm going to add a tiny little bit of voluma just right here and a tiny little bit on the chin. So at the end of the day, we're going to use 3 Voloxes and 2 volumas. So whenever we are doing chins and jaw lines, I normally create like a little package for my patients because it does take a lot of product, especially for males. For females, I normally use just maybe 1 and 1 of Bullocks or lift like we did last time. And then maybe 1 voluma. That's a good number. So 3 syringes, but males, it's like 5 or more. So a little bit of product right there. And I'm just creating little lines right there. I don't know if the camera, you can see the lines, but I see the jolt right here that we kind of like delineated right there before we started. So I wasn't adding too much right here. It was more like right here. That looks good. I like it. So now in that same little entry point where I'm going to go in and I'm going to add a tiny little bit of voluma right there, but I'm going to do a tiny little bit with the needle first on the chin. Show me your tongue. Okay, very good. Okay, relax. Perfect. So when I'm going to do chins, I always assess their natural coloring on their tongue. Because remember that sublingual artery is kind of like running close to where we're going to be treating. So yeah. So and patients have like different colors, right, on their tongues, but obviously it's supposed to be nice and pink at all times. And I'm going to do it on the other side just because I'm right-handed. So I'm planning on doing maybe like a 0.4, 0.5 maybe with the needle. And then maybe 0.25, 0.25 on the pre-jaws. Tiny, tiny amount. Just to soften it. Okay. And we have the midline, right? Because he's a male, we can go a little bit farther out. But remember that the sublingual artery runs like 6 millimeters away from the midline. So just be careful. Nice and slow aspirating, right? Whenever you're doing males, because we're getting closer to the area. And for him, I don't want to elongate the chin. So we want to give a little bit of projection, lateral like projection. So I'm going to go in a 90-degree angle, right? If it was a female and we were trying to elongate the chin, you go in kind of like in a 40-degree angle. So I'm going nice and straight. Yeah. Perfect. Aspirate, nice and slow. Doing good. And I always put my finger under it. You can almost kind of feel the product going in. And again, always assessing color, right? Everything. Going to right there. And elongating the chin, it's automatically going to enhance the jawline. So that's why I wanted to give you a little bit of that chin. You have a good chin, but you could use a little bit of projection on the side. And it just helps the jawline so much. Okay. Perfect. Chins tend to be a little bit tender. Okay, so tomorrow you're probably going to be a little bit tender on your chin. Doing good?
Mm-hmm. Didn't hurt at all.
Good. And if the patient wants or needs, right, a really chin, you didn't need it much, but if they really needed chin, you can do like the full 1 ml if you wanted to on the chin. You can go a little bit farther out, right, and create that kind of like volume and that kind of like squareness. You can do so many things. And Voluma is great because it gives you enough volume and enough projection, but it's still soft, which is really, really good. Like if you had like a patient that really, really needed chin, I don't think you'll never be able to create the volume that you can create with Voluma, like with Define. for example. But if you have like a female patient that just needs a little bit, I think Define works great. But if you have somebody that really you need to create volume, Voluma is great. I'm going to change the needle. And I'm going to do another 0.2 right in the middle just to give them a little bit more projection. Doing good. Aspirating. So I ended up doing a 0.6, okay, on the chin. We have a 0.4. I'm just going to blend a little bit of that 0.2 Voluma right there on the pre-jaw area. And I'm going to come in from the same little entry point that we created so we don't have to poke them again. So you're going to end up with just one little poke for the cannula, which is nice. And with the same little entry point that we created, I'm just going to add like a 0.2 right here on the pre-jaw area, just to blend that little indentation that you have right there. Okay. A little bit of movement, okay. Movement, okay? And I always kind of like guide my cannula, like palpating it with my other finger so I can feel it right there. I know the depth of it. So I'm just going to add a tiny little bit right here just to soften that area. Nice. Turn your head just a tiny little bit. Beautiful. So I'm palpating with my finger and I know where my cannula is. Can you see it right there? You see the depth? And I'm just going to do kind of like a couple of lines right there. Good, good. I like that. I saw it. There, that's it. That's the 0.2. Nice. So same little cannula entry point. Little bit of movement. And again, those little short movements, I feel like it's the easiest way to kind of like those kind of like going in this way. That's why if you see a plastic surgeon, how they do their lipo, right? They're always doing those little short movements because it just helps the cannula glide so well under the skin. I want it more superficial. And obviously, if you angle your cannula this way, right, the cannula is going to go deeper, right? If you keep it kind of like angle, kind of like more parallel to the skin, it's going to stay more superficial. So that's how you can kind of like play with the depth of your cannula. You can see it right there. So it's still superficial. And I'm going to add a tiny little bit right there. And then I want to add a tiny little line right there. Feeling good. Perfect. So the tip of my cannula is right here. Okay. I'm going to add a tiny little line right there. That's it. And because the sublingual artery is close, right, to that area, on top of the normal instructions that I always give my patients, right, which is excessive swelling, excessive bruising, or any pain, you need to report right away. Those are the instructions that I always give my patients. So a little bit of swelling, a little bit of bruising, a little bit of tenderness, that's perfectly normal. But if it's ever more than just that, right? If it's instead of tenderness is pain, instead of like a little bit of swelling, it's crazy swelling or crazy bruising, that's something that you need to report right away. On top of those instructions, when I do chin with needle, I always like to tell the patients if you feel any tingling, any numbness, any blanching or discoloration on your tongue, that's something that you need to report right away. If something's going on, you're going to feel it within the first 24 hours. Okay, it's not going to be delayed. And that's why I always check before starting the treatment and then after they leave. Okay, or before they leave. After they leave, I don't think you can check. Okay, so let me mold a little bit. That looks really good. I really like it. I think enhancing the chin helps so much. So much. So I was talking to Dr. Sewell, and he mentioned that he doesn't have any like clenching issues or any history of like breaking his fillings on the molars or any like tension headaches in the morning, nothing like that. He doesn't have any symptoms. So he's technically doesn't have any TMJ issues, but if you could only feel how strong his masseters are, I think he will do great if we did a little bit of toxin on his masseters. So we didn't want to do everything at once. But maybe later on, he'll let us do it. Botox, it's truly mimicking bone. And that's why you don't want to do it on the cheeks, for example, because it's so robust and so cohesive, you can really, I feel like if you did a lot on the chin, which is approved for, but just a tiny little bit, or if you try to do it on the cheeks, which is not a label, right? It will give so much like volume and it's so like robust that you can kind of like maybe create some myomodulation of those muscles that you don't want. So definitely keep it just on the bone projection. So it's beautiful for jawline. I don't think there's anything that compares in another brand. Just like there's nothing that compares to contour. I mean, I work for Allergan, but I'm not married to it. There's great products on the other lines too, but I really don't think that there's like that's anything similar to it. That gives a lot of projection and with that cohesivity. Yeah. Lift is great. We have used Lift on him before. We had Voluma today, so we ended up using Voluma, and that's why I explained to my patients, I may say Voluma today, and then the next time when you come, I may recommend Contour or may recommend Lift. It's really just based on what you are wanting to create. He didn't need it a lot, so I knew Voluma was going to do the trick with just half and half, and that's why we did Voluma. But Lift is a great alternative. I think with the volume that he needed, I wouldn't use Contour. I think that would have been a little bit too soft because he did need a little bit of volume. So Voluma, like I said, it's kind of like the good in between, I will say, of the sharpness of the Lift and the softness of the Contour. I think Voluma is kind of like in between. It gives you volume, but it's still soft, which I really like. Okay. That looks really good. Okay, remember your bullocks, you're going to be able to feel, okay, for the first 4 weeks. It's going to feel a little bit lumpy, bumpy. That's very normal. Don't worry about it. Don't mold it. Don't touch it. You're definitely going to feel the little, kind of like the little bump that I created deep, okay, with the needle. I want it there, okay? So don't move it. Don't touch it. The studies show that it's more moldable during the first 3 days. So it's really important for you to mold it before the patient goes. Because remember, the patient is going to be a little bit tender, right? You are telling them not to touch it, so they're probably not going to touch it. So make sure that you are happy with how it feels. So it shouldn't feel too bumpy. Obviously, you're going to feel it, right? Because the product is there. But just make sure that it's kind of like there, but not super bumpy, if that makes sense. So, because it is more moldable during the first 3 or 4 days. After that, it's like it stays where it is. We did half Voluma on each cheek, okay, just the apple of the cheek. Then we did 1.5 bullocks, right, on the jawline, half deep on the goniolingual, then half with the cannula, kind of like creating a little bit of the border of the jawline. And then the other half, we did creating the border of the jawline right here, more medially, kind of like on the prejaw area, okay? And then we did 0.6 of Voluma on the chin with the needle. And then we did the 0.2 right here on the prejaw area, just to soften that area. And I think it looks really good. And these, I feel, are the treatments that are so natural looking. So it's kind of like giving you a refresher. You look younger, but it's hard to put the finger on what we just did. And those are the changes that I really like. Majority of your patients are going to need a little bit of mid-face. The chin is so important. So whenever you're treating jawlines, just make a plan to treat the chin that same day because it just kind of like complements so well. It just helps so much with the jawline. Again, if I wanted to give like a super sharp definition and it's like a younger patient, right, with thicker skin that I know that I can give like, that I can put a little bit like thicker, I love lift on those lateral aspects. But if I see that the patient, and then maybe do contour on the medial aspect, right? That's a great combination. And that's why they came up with both products, because they needed something softer for the medial cheek. So if I see somebody that maybe needs both, right? And maybe they're not planning to do the 2 syringes, maybe I will go for Voluma because I can treat both, right, with the same product. So it's kind of like a good in between. That's how I see it. And remember that, the difference in the indication, right? Voluma is indicated for 18 to 24 months. Lift is indicated for 12 to 18. That's how I explain to my patients. And it's really just what you're wanting to create. If you want that sharp definition, right, that it's just like exactly where you put it, lift is beautiful. With Voluma, you will create the definition. But if you touch it, it's kind of like softer, but it's still giving you the volume at the same time. It's kind of like, it's both of them are really good. I just use them depending on what is it that I'm trying to create.